Haig in teacht Catherine Connolly.
Minister, I welcome the opportunity to participate in this in the statements. Although I wish we weren't having statements, and I wish you were in here to tell us, starting with primary care in New Direction 2001, which I'm going to go into now, and I wish you were here telling us why that hasn't been rolled out, or which parts have and which parts haven't, and so on. Because primary care in New Direction 2001, how many years ago is that? 18 years ago. And we were told at that point, primary care is the appropriate setting to meet 90 to 95% of all health and personal social services need. Primary care needs to become the central focus of the health system. Primary care has to be rolled out. The introduction of interdisciplinary and multidisciplinary team-based approach, and so on and so on. And then, because we knew that governments of various persuasions are inclined to produce a report and not follow it up, a National Primary Care Task Force will be established. Similarly, do you remember Vision for Change? An implementation body was set up. It did such a good job over 2-3 year periods that the government dismantled it. In relation to primary care, a task force was to be established. In fact, 20 actions, not even recommendations, actions, and a community-based diagnostic centres will be piloted and so on, and an implementation plan. An implementation plan for primary care is outlined in this document, and so on. You might read it, you might have a look at it, because it's all there. Physical infrastructure 2001. Modern, well-equipped, accessible premises will be central to the effective functioning of the primary care team. A National Primary Care Task Force will be established. Evaluation is absolutely essential to the implementation. That's plan number 1. Many other plans. Okay? And I'll just quote from the one from the Adelaide Health Foundation. Many recommendations in that, tangential to that one. Future-proof the health system. Borrow ideas from abroad. Very interesting one here. Promote parity between physical and mental health in practice, not just in rhetoric. This is 2011. Promote parity between physical and mental health in practice, not just in rhetoric. Recognise and plan for the coexistence of physical and mental health morbidity in patients, and provide services that are in a position to respond to this type of complexity. And of course then we get the Sláinte Care document, which was brought about by the new Dáil, the range of voices in the Dáil telling you please do something about our health service. And of course Ireland distinguishes itself amongst its European colleagues by lacking or by not providing a universal, equitable access to either primary or acute hospital care. And you come here tonight, Minister, and you give us this document, your speech, and you go through it. Let me just kind of balance that a little bit with Galway City and County. Here's a health centre in Connemara. I'll spare the doctor's blushes, but I will refer to what's up on it. Private patients must pay €20 for blood tests. Medical card holders must pay €10 for blood tests. Okay? That has featured in different doctor surgeries throughout Connemara. The health service response is it's provided in the contract that they should provide the blood test free of charge. And obviously there's a disagreement, but that's the actual result for people on the ground. Lately I asked a question about social workers in Connemara. What was the waiting list? What was the number of vacancies, so on? Do you know what response I eventually got back? I was told there was no waiting list for social workers in Connemara. Why? Because there were no social workers in Connemara. Now, can you imagine that? That's the level of response. Now, I appreciate the man who responded to me. I appreciate his sense of irony. I appreciate his honesty. No waiting list because there are no social workers in Connemara. Simply, end of story. No physiotherapy services in South Connemara. Absolutely none. So people of all ages and vulnerability brought in from Connemara to Galway, Gaeltacht, Gaeltacht, Sheirbhísí all three Ghaeilge, agus níl se le fáil an áte bhfuil si de gol, an tá orthú teachtas já I lár na cathrach, tranglam teachta, sheirbhísí all trí Bhéarla in áit I Caisleán nua, agus go leis go Connemara. They have to come in, Minister, from Connemara to get physiotherapy in a place where services are provided in English, not in Irish and so on, adding to the traffic congestion, adding to all sorts of problems. So I'm here standing, and honestly sometimes I feel like I couldn't put words on what I describe when I stand here and I hear speeches about primary care and mental health and new ways of doing things, when all of these problems were foreseen, number one, and number two, solutions were given. And we went forward then to build primary care centres. In Galway, in Ghaeilge, we're paying over $250,000 of taxpayers' money on rent on a private building every single year. On the west side of the city in Galway, we have no primary care building. In the bad 80s, I had the privilege of working in community care. At that time, it was called community care, on a multidisciplinary team. In the bad 80s, where somebody could walk in and see a psychologist and or a speech therapist and or a social worker. And that was the bad 80s. And we thought things were improving. And now we're in a situation where we have all these beautiful reports, all this lovely language, and things have actually gone backwards. And in addition to that, we're paying high rent for buildings that should be publicly owned. Now, Minister, if we're seriously interested in primary care and taking the pressure off the acute hospitals, then we would roll out public buildings throughout the country, where we would locate the essential services, where we would take account of the regional balance, and we would certainly take account of the needs of those living in the Gaeltacht, agus sheirbhísí ag teasteal go Ghaeilge trí Ghaeilge. In relation to all of the reports, and I'm running out of time, so I'm going to just mention the Department of Health, Future Health, a strategic framework for reform for the health services for 2012 to 15. Primary care teams must form part of the dedicated facilities. No one must pay GP fees. GPs must work with other primary care professionals. Staffing and resourcing of primary care must be allocated rationally. Great absence of rationality. To be allocated rationally to meet regularly assessed needs. Structurally, primary care in Ireland remains highly fragmented. It involves a mixture of public and private patients, which is not an efficient or equitable way of arranging health care, and so on and so on. And yet, we're subjected to this all over again. This speech from you, whoever writes these speeches, and I've said this numerous times over the last few weeks, whoever writes the speeches, perhaps they should read the reports first. Look at the reports, look at the recommendations. I mean, you can take any period of your life, take 10 years. In this case, it's 18 years. But at the very least, work from the original report. I'll finish then on a review of primary care island services. Minister, I know it's difficult, and I know you're busy, and we're all busy, and I'm really finding it increasingly difficult to keep up with the reports. But there's a duty on us to read them, to look at them, and certainly there's a duty on whoever writes the speeches to read them. And so we have primary care island services. A review carried out in April 17 on all our islands, including the Irish-speaking islands. And a very good report. Of course, it wasn't published till earlier this year. No explanation given for the delay and so on. And it tells us, amongst many things, of the essential need for primary care services on the islands where we don't have hospitals. And then it looks at Galway, Inishbofin and Ardon, where we have health centres that are not fit for purpose. Now, these are very simple, practical matters. A health centre not fit for purpose on the island of Inishbofin and on Ardon. Níl siad cuí. And there are many other recommendations in it in relation to the Irish language and so on, which I'm not going to go into. But, Minister, I believe in your bona fides. I believed it in relation to many other subjects that you spoke on in the Dáil. But at the end of the day, the proof of that is when you actually look at what was on the ground in these reports, excuse the pun, and what's not on the ground, the bad pun, and tell us why. What's happened? And why can't we roll out public buildings for primary care if we're seriously interested? Gar magat.